Our case today is a female patient, middle age, about 37 years old, presented by long history, about 3 months of upper abdominal pain. She was diagnosed as having gastritis and duodenitis, and she received PPIs and anti-H. pylori treatment. However, she didn't improve. She didn't improve with such conventional treatment. We did for her abdominal ultrasound. We found such changes in the pancreas. As you see, the pancreas is irregular outline. There is some echogenic bands like fibrous bands, a picture of chronic pancreatitis with dilated pancreatic ducts, as you see here. This is dilated pancreatic duct at the body. It's about 5 millimeters. Actually, normally it is doesn't exceed 2 millimeters in young females. So we see such changes, and it is bulky pancreas, not atrophic pancreas. And strange enough that we follow this pancreatic duct. Actually, this is a dorsal duct, which is the duct of Santorini, not the duct of Versang. And we follow this duct. It doesn't go down to the head of the pancreas as usual to join the common bile duct to enter into the major papilla. So it looks like pancreatic divisum detected by abdominal ultrasound. And this may explain the recurrent attacks of abdominal pain the patient has, and maybe there is long history, more than these 3 months, but in the last 3 months the attacks were so severe, and it seems to be a sort of acute pancreatitis on top of chronic pancreatitis, as pancreatic divisum is known to be a cause of recurrent attacks of pancreatitis with chronicity. As you see here, this is the duct of Santorini, not duct of Versang, and it doesn't seem to go down here to the head region. Here is the head, and here is the body, and here is the tail. So as you see, again, we put Doppler in order to see. There is another small ductal structures here. I am not sure whether this is a common bile duct or the duct of Versang, the ventral duct. This is a dorsal duct. So, but however, it's not that dilated. Even if it is a common bile duct, it is not that dilated. But for me, I think this is a duct of Versang, because this is not the usual appearance of the common bile duct. Usually the common bile duct will appear here, so it is more going to the pancreatic tissue. So I think this is the duct of Versang. We have the two duct of Santorini and duct of Versang, the dorsal duct and the ventral duct. Maybe we have some photos for the portal vein. We studied the portal circulation, its patents, and here is the, again, this is the one of the hepatic veins, and again we have such findings, very characteristics of being irregular outline like that, and these white bands denoting some sort of fibrosis. Of course, pancreas is best seen by EUS, but we use the abdominal ultrasound as a first tool to detect the pancreas. Then we are going to ask many investigation for this patient. Of course, MRI and MRCP and the biochemical tests, and also we may ask for EOS evaluation, endoscopic ultrasound evaluation, and also the patient, if it is pancreatic divisum, she may need ERCP with sphincterotomy of the minor papilla and stent replacement. So a lot of work up is needed for this patient, and we change by this ultrasound finding, we change the diagnosis. At the diagnosis before was gastritis, duodenitis, and now the diagnosis is completely changed. And thanks to abdominal ultrasound, and thanks to experience in abdominal ultrasound in detecting the pancreas, and of course we may need also to do CT for her, but I think MRCP, MRI, and AUS are very important in this patient. And of course, we are waiting for your comments and your ideas as regards this case. And thank you.